Welcome back to the deep dive. Today, we're getting into a health issue that's way more common than you might think, but often hidden: alcohol use disorder.
Yeah, AUD. It affects millions, but, the stigma around it, plus just the difficulty in getting accurate reports, means a lot of people aren't getting the help they need.
Exactly. And while diagnosing AUD clinically is one thing, the physical side of chronic alcohol use leaves these real marks on the body, marks that, well, imaging can actually pick up now.
That's right. We're focusing on a specific medical article today, looking at the visual evidence, how imaging shows the effects of AUD-related diseases across different parts of the body.
It's like a guide to spotting the damage.
Pretty much.
So our mission for this deep dive is to unpack this, understand how radiologists use things like MRI, CT, ultrasound, how they spot these signs.
Right. And how seeing these clues early can make a huge difference for patients, leading to intervention and hopefully better outcomes.
It's all about seeing those hidden physical effects, the clues that imaging gives us.
Exactly. It's a powerful window.
Okay, let's dive in. The article really hits home the scale of this problem right away. AUD isn't just one thing. It's linked to, well, a whole list of issues.
Oh, yeah. Nervous system damage, heart problems, liver disease, certain cancers, even things like increased risk of injury, problems during pregnancy. It's extensive.
And the stats are pretty staggering. Like globally, harmful alcohol use is tied to about 5.3% of all deaths.
And in the U.S., for adults aged 20 to 64, it's a factor in something like 1 in 8 deaths. It's huge.
A big part of the problem, as you mentioned, is just knowing how much someone is actually drinking. Self-reporting is tricky.
It really is. There's bias, maybe memory issues. Sometimes people just don't realize how much it adds up. So relying only on that can mean diagnoses get missed or delayed.
Which brings us to imaging. The article is clear. You don't diagnose AUD itself from a scan.
Correct. You can't point to an MRI and say that's AUD.
Yeah.
What imaging is brilliant at is showing the consequences.
The damage.
Exactly. The liver disease, the specific brain injuries, the pancreatic issues. When radiologists see these patterns, these known signatures of alcohol damage, it's a massive red flag.
So it prompts the question, could AUD be underlying this?
Precisely. It adds objective evidence to the picture. And catching it early via these visual clues, that can be a game changer.
Allows for intervention, maybe stopping further damage.
Yeah, potentially halting or slowing it down, managing complications. It improves the long-term outlook significantly.
Finding the physical footprints alcohol leaves.
That's a good way to put it.
So how does alcohol actually do this damage, biologically speaking?
Well, there are a couple of main ways. First, alcohol itself is toxic to cells, and so is its main breakdown product, acetaldehyde. That one's actually classified as a carcinogen.
A carcinogen, wow.
Yeah. Plus, metabolizing alcohol creates reactive oxygen species. Think of them as causing oxidative stress, damaging cells.
Okay, direct toxicity and stress. What else?
Then there's the gut. Alcohol messes with the lining of your gastrointestinal tract, the gut barrier.
How does a leaky gut cause problems elsewhere?
Because it lets things leak out that shouldn't, like endotoxins from gut bacteria. They get into the bloodstream.
And trigger inflammation all over.
You got it. Systemic inflammation. So it's direct poisoning and this broader inflammatory response.
And it affects everyone differently.
Definitely. Genetics play a role. Gender females tend to be more susceptible to organ damage at lower amounts. Lifestyle factors like smoking, diet, other health issues, it all interacts.
And the article mentions even small amounts increase cancer risk.
Crucially, yes. The idea that only very heavy drinking is risky, especially for cancer, isn't quite right. Even moderate amounts are linked to increased risk for sometimes.
That's important. Okay, let's follow the article system by system. It starts with the brain, the central nervous system.
Right. Alcohol hits the CNS in multiple ways. Direct neurotoxicity, increased risk of head injuries, obviously, and also indirectly from damage to other organs, like the liver, affecting brain function.
And MRI is the go-to tool here.
Generally, yes.
Yep.
MRI gives the best detail of the brain structures.
Okay, specific conditions. Wernicke-Korsakoff syndrome, that's one people often associate with chronic alcohol use.
It is. It's a classic example caused by a severe lack of thiamine, vitamin B1, often because of poor nutrition linked to AUD.
It has two phases.
Yeah, the acute phase is Wernicke encephalopathy. Clinically, you see things like ataxia, trouble with coordination, confusion, problems with eye movements. If that's not treated quickly with thiamine, it can lead to the chronic, often irreversible Korsakoff amnesic syndrome.
Which involves severe memory loss.
Profound memory loss, yeah.
So what are the telltale signs on an MRI for Wernicke's?
Radiologists look for specific changes. On certain MRI sequences like T2 and Fel-IR, which are sensitive to water content like swelling or inflammation, you see areas of increased signal bright spots.
Okay.
And often on diffusion-weighted images, you see restricted diffusion, which points to acute cell injury. The key is where these changes are and their pattern.
Location, location, location.
Absolutely. Typically, they're symmetrical, meaning on both sides of the brain, and in very specific deep structures. The medial thalami, the mammillary bodies,
Sure.
around the cerebral aqueduct in the brainstem, the tectal plate.
Very specific spots.
Yes. And sometimes the cerebellum or lower brainstem, too. The article really stresses it's probably underdiagnosed, and getting thiamine in early is crucial.
Got it. Symmetrical deep structures. What about osmotic demyelination syndrome or central pontine myelinolysis? Sounds nasty.
It involves damage to myelin, the insulation around nerve fibers. Most classically, it hits the pons, a key part of the brainstem. It's not only seen in AUD, but it is more frequent, especially when someone's low blood sodium is corrected too fast.
The rapid correction is the trigger.
Right.
And the MRI signature.
Again, MRI is key. You see T2F layer hyperintensity, those bright signals, and often restricted diffusion right in the center of the pons.
Okay.
But what's characteristic is that it usually spares the edges, the periphery of the pons, where certain nerve tracts run. This can create a sort of trident shape or bat wing appearance.
A specific visual pattern again.
Exactly. And sometimes similar damage happens outside the pons, too. That's extrapontine myelinolysis.
Moving on, hepatic encephalopathy. This links the liver back to the brain.
Right. This happens when the liver is severely damaged, often from alcoholic cirrhosis, and can't filter toxins properly. Things like ammonia and manganese build up and affect brain function. It can actually be reversible sometimes.
How does that look on a scan?
In the acute phase, it can be subtle. Maybe some T2 signal increase in the cortex or along nerve tracts, some nonspecific white matter changes. But in the chronic form, particularly linked to manganese buildup, you see something quite distinct on T1-weighted images.
T1, okay. What happens then?
You get symmetrical increased signal T1 shortening, making areas look brighter in deep gray matter structures. The globus pallidus, substantia nigra, subthalamic nuclei, it's the manganese depositing there.
So the brain scan reflects the liver failing to detox. What about hypereminemic encephalopathy? Related.
It's very related. In really severe liver failure, super high ammonia levels cause specific brain swelling, affecting astrocytes, the support cells. MRI often shows restricted diffusion, that acute injury sign, especially in the insula and cingulate gyrus, though other areas can be involved too.
Wow, quite a range of brain issues. Markia-Favre-Bignami disease. Sounds rare.
It is pretty rare. The exact cause isn't totally nailed down, but it's strongly linked to nutritional issues and chronic heavy drinking. Though, interestingly, it can happen without AUD sometimes. It involves damage, demyelination, and even necrosis, specifically in the corpus callosum.
The big connection between the brain hemispheres.
That's the one. Often hits the front, genu, or back, splenium.
And imaging.
MRI shows T1 hypointensity, darker, and T2FLR hyperintensity, brighter in those callosal areas. Acute phase shows restricted diffusion, sometimes contrast enhancement. Over time, it can lead to thinning or atrophy of the corpus callosum.
Then there's alcoholic dementia, which you mentioned is a bit controversial.
Yeah, debated partly because other things like nutrition or head trauma also impact cognition in AUD, but imaging in suspected cases often points to disproportionate atrophy, especially in the frontal lobes.
The planning and decision-making centers.
Right, and alcoholic cerebellar degeneration. That affects balance. Yes, coordination and balance problems. Imaging typically shows atrophy focused on the anterior superior part of the cerebellar vermis, that central upper front bit of the cerebellum.
And finally, for the CNS, the article covers fetal alcohol syndrome, FAS. Just devastating.
Critically important. It's the leading preventable cause of birth defects and neurodevelopmental issues. Alcohol exposure at any time during pregnancy can cause it. The fetal brain is vulnerable throughout.
What kind of brain damage does imaging show in FAS?
It varies hugely, but you can see major structural problems, things like the corpus callosum being partly or completely missing, an underdeveloped cerebellum or pituitary gland, a simpler pattern of brain folds.
Simplified gyri.
Yes, and just overall smaller brain volume cortex, cerebellum, basal ganglia, microcephaly, small head size, and neural tube defects can occur too.
And it's not just the brain.
Now, imaging might also pick up associated heart defects, kidney problems, skeletal issues. Plus, there are those characteristic facial features radiologists need to be aware of.
It's incredible how specific the CNS damage can be. Okay, let's move down to the heart and lungs, the cardiothoracic system.
Alcohol's effect on the heart is Complicated. Heavy chronic use definitely increases risks like irregular heartbeats and sudden death. The article highlights alcoholic cardiomyopathy, ACM.
How common is that in heavy drinkers?
Estimates are around 1–2% of chronic heavy drinkers, more often in men. The risk really climbs with intakes around 80 grams a day. That's maybe 6 or 7 standard drinks for over 5 years.
And what's happening to the heart muscle itself?
ACM means the left ventricle, the main pump, gets progressively bigger, dilated, and weaker. Yeah. Its pumping function, the ejection fraction, drops often below 50%. It can start silently but lead to heart failure.
High mortality too.
Sadly, yes. About 50% mortality within 4 years of diagnosis.
Can imaging pick this up?
Oh, absolutely. Chest x-ray might show a big heart. Echo heart ultrasound is key for size and function. CT and especially cardiac MRI give great detail.
What does MRI show specifically?
The enlarged, poorly functioning ventricle. Sometimes MRI might show low T1 signal, maybe hinting at fat infiltration in the muscle, and often shows late gadolinium enhancement in a pattern suggesting non-ischemic damage not from blocked arteries.
Okay. What about hepatopulmonary syndrome, liver and lungs again?
Yeah, this happens in advanced liver disease like AUD-related cirrhosis. Basically, abnormal widening of blood vessels in the lungs leads to low oxygen. Imaging like X-ray or CT might show patchy opacities, often at the lung bases or in large pulmonary vessels as clues.
And the article also flags higher risk for pneumonia and ARDS.
Definitely. Chronic alcohol use weakens the immune system and lung defenses. People are more likely to get pneumonia, and it's often more severe. Aspiration risk is higher, too.
Aspiration pneumonia shows up on scans.
Yes, you might see opacities or consolidation, often in the dependent parts of the lungs where aspirated material would go. And crucially, AUD increases the risk of ARDS, acute respiratory distress syndrome, by 3 to 4 times. That's severe lung injury.
With high mortality.
Very high, 40–50%.
What does ARDS look like on CT?
Widespread, often bilateral opacities. Can look like hazy ground glass areas or denser consolidation. It means severe inflammation and fluid filling the air spaces.
So clearly not just one organ system. Let's move to the GI tract and pancreas.
Alcohol is a direct irritant, right from the esophagus down.
Causing things like esophagitis or those Mallory-Weiss tears from vomiting.
Exactly. And gastritis in the stomach CT might show a thickened stomach wall. It also impairs nutrient absorption and, like we said, increases gut permeability, which connects back to liver damage.
Autobrewery syndrome was mentioned. Rare.
Very rare. Where gut yeast ferments food into alcohol, imaging might occasionally look for underlying gut issues like blockages that could contribute.
Okay, the pancreas. Alcoholic pancreatitis, a big one.
Huge. It's the most common cause of chronic pancreatitis in many places. Alcohol causes a spectrum from acute attacks to chronic destruction. Risk goes up with dose and duration, but genetics and smoking play roles too.
And the acute attacks lead to the chronic state.
Often, yes. Repeated inflammation causes irreversible scarring. If someone has acute pancreatitis without gallstones, alcohol is a top suspect.
What does the damage look like on imaging? CT mostly.
CT is often the first step for acute pancreatitis.
Yeah.
Shows pancreatic swelling, inflammation around it. It's also vital for spotting complications.
Right.
Fluid collections, pseudocysts, tissue death, necrosis, which can get infected sometimes. You'd see gas bubbles on CT indicating infection. Also, bleeding from pseudoaneurysms or blood clots, especially in the nearby splenic vein.
And the chronic changes.
That's long-term damage. The pancreas looks shrunk and atrophied. The main duct can be dilated, and you often see calcifications, little bits of calcium, scattered through the gland. Heavy alcohol use is the most common reason for this picture.
Okay, head, chest, gut. Let's focus on the liver now. Alcohol-associated liver disease, ALD. A major killer.
It is, and often silent until it's advanced. ALD is a spectrum. Starts with hepatic steatosis, fatty liver. Super common.
Affecting almost everyone who drinks heavily.
Up to 90%, yeah.
How does fatty liver look on scans?
On ultrasound, it's typically diffusely brighter, more echogenic. The edges of blood vessels inside might look blurred, and the sound beam doesn't penetrate as well. On CT, it looks darker, hypoattenuating. Less than 40 Hounsfield units usually means moderate to severe fat.
And MRI is best for quantifying the fat.
Yes, MRI can calculate the proton density fat fraction, PDFF. Gives you a percentage. Over 5–6% means steatosis. It can also show if the fat is patchy.
What about the next steps? Inflammation, scarring, steatohepatitis, fibrosis?
Harder to tell simple fat from inflamed fat steatohepatitis just on basic imaging, though a patchy look might be a clue. This is where elastography is key.
Measuring stiffness.
Exactly. Ultrasound shear wave elastography, or MR, elastography, MRE. Stiffer liver usually means more fibrosis, more scarring.
Can that replace biopsy sometimes?
Increasingly, yes. MRE is especially good here because fat doesn't mess up its measurements like it can with ultrasound elastography. They can stage fibrosis pretty accurately now, non-invasively.
And the end stage is cirrhosis.
Right. Diagnosed on imaging by the liver shape and texture changing. It gets bumpy, nodular contours, irregular edges. Often the right lobe shrinks, while the caudate or left lobes get bigger. Plus signs of portal hypertension usually appear in enlarged spleen, fluid, dilated veins.
And cirrhosis is way more common in ALD.
Oh yeah, about 13% with ALD versus maybe 0.3% normally. And ALD is now the #1 reason for liver transplants in the U.S.
And cirrhosis dramatically increases liver cancer risk, HCC.
Huge risk factor. Dynamic contrast CT or MRI is how we look for HCC, using specific criteria called LIR-DISIS.
What about acute alcoholic hepatitis? Sounds very serious.
It is. Severe liver inflammation, often in someone with underlying ALD, very high short-term mortality, maybe 50% in 3 months, usually triggered by heavy recent drinking. Presents with jaundice, severe liver dysfunction.
How does that look different on scans?
The liver might look abnormal in shape, have patchy fat, strange contrast enhancement patterns. Sometimes inflamed areas can even mimic tumors to the tumoral lesions. Interestingly, MRE during acute alcoholic hepatitis often shows very high stiffness. But that's mostly the acute inflammation, not just underlying cirrhosis, so you need to interpret it carefully.
Any other subtle ALD signs radiologists look for?
Sometimes you see unusual patterns like fat only in certain zones or iron depositing around veins. Recognizing these can be clues, especially if the history isn't clear. And imaging, plus elastography, helps track response to treatment, like stopping drinking.
Okay, beyond the big ones, brain, heart, lungs, GI, liver. What else does the article mention? Kidneys?
The link there is a bit more debated, less direct maybe. Alcohol's impact might be more indirect, tied to systemic inflammation or damage to other organs like the liver or heart that then affect the kidneys.
Hormonal and immune effects.
Definitely. Chronic use disrupts hormones and suppresses the immune system, making infections more likely and fuels that body-wide inflammation.
And musculoskeletal.
Yeah.
Muscles and bones seem to take a hit too.
Yes. Alcoholic myopathy, muscle damage, can be acute after a binge, causing severe weakness, or chronic, leading to progressive weakness, often in proximal muscles.
Like shoulders and hips.
Exactly.
Right.
MRI might show muscle swelling edema in acute cases, or fatty replacement and atrophy in chronic ones.
And bones. Osteoporosis risk goes up.
Significantly. Alcohol messes with bone formation and increases breakdown. Higher fracture risk even with moderate drinking. X-rays, CT, MRI are used to check for fractures.
Then there's osteonecrosis, particularly of the femoral head. AUD is a leading cause.
A critical point. After steroids, alcohol is the next most common cause of non-traumatic osteonecrosis of the hip. Thought to be due to disrupted blood supply, maybe linked to fat metabolism issues, often affects both hips.
Debilitating pain, potentially leading to hip replacement. How's it seen on imaging?
X-rays are often normal early on. MRI is much more sensitive. The key is seeing changes in the bone right under the cartilage at the end of the femur.
What kind of change?
On MRI, you look for a specific line, dark on T1 and T2 images, the geographic line. And even more specific is the double line sign on T2, a bright line next to a dark line. That's considered pathognomonic, a dead giveaway for osteonecrosis. Finding it early with MRI is key for trying to save the joint.
Wow, that double line sign. Finally, gout. Link debated.
Yeah, traditionally linked, especially beer due to purines, but maybe other dietary factors eaten with alcohol play a big role too. Imaging shows typical gouty erosions on X-ray, and dual energy CT is great at showing the uric acid crystal deposits, the tophi.
It's really striking, the sheer breadth of damage across so many systems, all visible on scans. The article also highlights the link between alcohol and trauma.
A massive public health issue. Alcohol intoxication is involved in, 30–50% of trauma cases, and about a third of trauma deaths.
Impairs driving, obviously.
Hugely. Even low levels affect driving. Risk of fatal crashes skyrockets with higher BAC, and studies show higher BAC often means more severe injuries, especially head and limb trauma.
And because intoxication messes with mental status, imaging is crucial.
Absolutely vital. Head CT is standard because you can't rely on the patient's report. Alcohol-related falls often cause bad head and face injuries too. Plus, the immunosuppression increases infection risk after trauma.
And lastly, the unavoidable link, alcohol and cancer.
It's classified as a human carcinogen. Acetaldehyde damaging DNA is key, but oxidative stress, hormone disruption also contribute.
And there are specific cancers with a proven causal link.
Yes, clear links for cancers of the mouth-throat, oropharynx, esophagus, liver, colon, rectum, and female breast. For breast cancer, it seems related to estrogen levels.
And the risk starts even with small amounts.
That's the crucial takeaway. It's not just heavy drinking. Risk increases even with moderate regular consumption, and it accumulates. Imaging detects and stages these cancers, of course, but finding them underscores alcohol's systemic carcinogenic potential. So, this deep dive really paints a picture, doesn't it? It shows the extensive physical damage from alcohol use disorder, often hidden, going way beyond just the liver.
Absolutely. We've talked about specific brain changes, the weakened heart, the inflamed pancreas, scarred liver, fragile bones, even the cancer risk. These visual footprints are everywhere in the body.
And that's the power of imaging highlighted in this article. It gives objective visual proof. Those scans show the footprints, whether it's the classic Wernicke's lesions, the cirrhotic liver shape, or that double line sign in the bone.
Right, and recognizing these specific patterns is so important. It gives radiologists, clinicians, the tools to potentially spot AUD-related damage much earlier.
Exactly. That early visual flag can trigger the right investigations, get a diagnosis, start interventions, all crucial for better outcomes, maybe even reversing some early damage.
It really frames AUD not just as a behavioral issue, but as a serious disease with tangible physical effects.
Effects you can see, which require medical attention, just like any other chronic illness.
So knowing all this, knowing alcohol can cause such widespread, often invisible damage that only specialized imaging can reveal, how does that shift your perspective on alcohol use disorder? Does seeing this concrete physical evidence maybe help reduce some of the stigma and really push us to view it as a serious medical condition needing proper diagnosis and treatment? Something for you to think about after this deep dive.